Welcome to Disease Detectives, a drug that's reshaping bodies, hyped by a billionaire visionary, backed by jaw-dropping studies, but is it hiding side effects you need to know? Today, we're cracking the case on Wegovy, the weight loss injection taking 2025 by storm. Did Elon Musk really drop 30 pounds with it? What did a New England Journal of Medicine study reveal? And what risks could derail your weight loss journey? Stick around, because we're about to uncover the truth. If you're new here, hit that subscribe button and join our detective squad, where we solve health mysteries with science. Let's dive in. Let's start with the basics. Wegovy is a prescription drug powered by its active ingredient, semaglutide. It's a GLP-1 receptor agonist, which means it mimics a hormone in your body called glucagon-like peptide 1. That hormone helps control your appetite and blood sugar. The FDA approved Wegovy back in 2021 for long-term weight management in adults with obesity, defined as a BMI of 30 or higher, or those who are overweight with conditions like high blood pressure or type 2 diabetes. It's even approved for teens 12 and up who meet the criteria. You take it once a week, by injection, usually in your stomach, thigh, or arm. Sounds simple, right? But how does it actually help you lose weight? Let's investigate. Wegovy's power lies in how it hijacks hunger. It signals your brain's appetite center, especially the hypothalamus, to dial down hunger and make you feel full faster. Imagine eating a small meal and feeling satisfied for hours. That's Wegovy at work. It also slows down how fast your stomach empties, so food stays in longer, and cravings fade. Craving late-night ice cream? Wegovy might help you walk away. It doesn't stop there. Wegovy also stabilizes blood sugar by boosting insulin when needed and reducing glucagon, the hormone that raises blood sugar. That's why the same ingredient is used at lower doses in Ozempic for diabetes. But remember, Wegovy isn't magic. It works best with a calorie-controlled diet and regular exercise. Think of it as a booster, not a shortcut. Compared to similar drugs like Saxenda, Wegovy goes further. It crosses the blood-brain barrier, which gives it a stronger grip on appetite control. Let's break down that major study we teased earlier. The Step 1 trial, published in the New England Journal of Medicine in 2021, is a major reason Wegovy exploded in popularity. Over 68 weeks, researchers followed 1961 adults with obesity or overweight, but no diabetes. One group took Wegovy, the other took a placebo. Both followed a lifestyle program. The results? Wegovy users lost an average of 14.9% of their body weight, about 33 pounds. The placebo group lost just 2.4%. That's a game changer. Over 83% of Wegovy users lost at least 5% of their weight. Nearly half lost 15% or more. Want to dive deeper? We've linked the study in the description, and it doesn't stop there. A 2023 update from the SELECT trial, also in the New England Journal of Medicine, showed Wegovy cut the risk of heart attack, stroke, or heart-related death by 20% in people with obesity and cardiovascular disease. That led to a new FDA approval in 2024, this time for heart health. But here's the catch. Most people regain the weight within a year if they stop the injections. Wegovy isn't a one-and-done solution. It's a long-term commitment. Now, let's talk about that billionaire we mentioned, Elon Musk. In 2022, Musk tweeted that Wegovy helped him lose nearly 30 pounds. By 2025, his slimmer look at events, like Tesla's Q1 earnings call, keeps the buzz going. Photos show a leaner Musk than in 2021, hinting he's stuck with Wegovy. And his post sparked a wildfire, especially on X, where users flooded the platform with personal success stories. Sure, Musk has personal chefs and elite trainers, but his story shows what's possible if you commit to the plan. Seen any transformations like this? Drop your thoughts in the comments. So, what results can you expect? Musk's 30-pound drop matches the STEP trial's average. In real-world use, people often see visible changes in 4 to 12 weeks. The STEP 5 trial showed users kept off 10% of their weight for up to 4 years with ongoing use. For many, that means shedding 20 to 40 pounds in a year, if paired with diet and exercise. Social media is full of users reporting 15 to 25 pounds lost in just 6 months. Results vary, of course. So what's your weight loss goal? Share it below. Let's support each other. Here's where it gets serious. Side effects. Most common? Nausea, reported by 44% of users, especially at the start. Next, diarrhea, 30%, vomiting, 24%, and constipation, 20%. Other symptoms include bloating, heartburn, and stomach pain. For some, it's too much. 8% quit due to nausea alone. Rare but serious risks include pancreatitis, sudden belly pain, and vomiting. Gallstones, seen in 2 to 3% of users. Possible thyroid tumors, spotted in animal studies. Human risk is unclear, so if you notice neck swelling, hoarseness, or trouble swallowing, see a doctor immediately. There's also a risk of low blood sugar, especially if you're on insulin, and it may worsen diabetic eye disease. About 17% of users stop the drug due to side effects. Bottom line? Talk to your doctor, especially if you have a history of thyroid issues, pancreatitis, or kidney problems. So, should you try Wegovy? It's powerful. It's backed by science. It helped Elon Musk drop 30 pounds. But it's not cheap, around $1,300 per month without insurance. And coverage? Still hit or miss. It's also a weekly shot and a lifelong choice for many. If Wegovy isn't a fit, other options like Zepbound or Contrav may be worth exploring. Again, we're not doctors. This is just the research. Use it to make smart decisions with your healthcare provider. Case closed on Wegovy detectives. We've uncovered how it works, the studies behind it, Musk's transformation, and the side effects you can't ignore. Want more on weight loss meds like Mounjaro or Zepbound? Let us know in the comments what health mystery you want solved next. Check out the New England Journal of Medicine study linked below for the raw data. If this helped, smash that like button, share it with a friend, and subscribe to Disease Detectives for more truth-packed investigations. Keep sleuthing, and we'll see you in the next case.